Welcome back to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the final video in this exercise program for called Patellofemoral Syndrome, exercise program number 1. And this is actually a stretch. This is that quadricep stretch that I talked about in the very first video when I was just explaining about what that patellofemoral syndrome is and the signs and symptoms that people tend to have with that. So this is a stretch that you're going to do, and for this stretch you're actually going to do it in this phase of this program. I'm also going to include this in the program number 2 when you move on to that, but in this program you're going to do this stretch gently right now. And it's important that you do it gently, because if you do this too much you will only irritate, or you could flare up that knee pain. And then we won't really know if this program is going to work for you. So you're just going to do this stretch gently. And you're going to need some kind of surface to put your foot up on, the bad foot, the painful side. So you can use a bench like I have, but most of my patients will tell me they use an ottoman or a coffee table, a kitchen chair, even a kitchen table if you have enough flexibility in your quadriceps. So I'm going to show you on this bench here, and let me just show you that. For this stretch, you're going to bend your painful leg up like this behind you and put it on that surface. So the front part of your foot, so the top of your foot and your toes are resting on that surface, whether it's a bench like this, or ottoman, or a kitchen chair. And then what you're going to do is just face directly forward, directly forward or away from that surface or your foot. All right, so the first movement you're going to do is actually leaning back as far as you can till you feel a good stretch in that quadricep, so the muscle on top of that thigh. Now, once you feel a good stretch here, then what you're going to do is, and this is why I want you to do this next to something. So if you're using a kitchen chair, do this next to your kitchen counter or your kitchen table, just so you have something to hold on to if you start to lose your balance. Safety is first and foremost the most important thing. I wouldn't want you to lose your balance and fall. So I'm going to use the wall here, but again, I'll have that bent back position. I'm going to hold that bent back position. I'm not going to come back forward. I'm going to hold this here. And then what I'm going to do is rotate toward my leg, hold that for about 20 seconds. Then I'm going to come back to the middle position, and I'm going to rotate away from my leg, holding that for 20 seconds also. All right, so that is your quad set or your quadricep stretch. I want you to, now that counted as 1 repetition. All right, so again, that bent back position, leaning or rotating toward my leg for 20 seconds, rotating away from my leg for 20 seconds. That's 1 repetition. When you do that, I want you to do 5 to 6 repetitions for that painful leg. All right, now, if the surface you choose is just too low, you're not feeling much of a stretch here, it just means that you're a little more flexible, so you need a higher surface. So just experiment with some different things at your house and see what you can do. I show this exercise a lot. This stretch. I actually do this stretch a lot. So I can use a pretty high surface. It takes a higher surface or my leg being bent up more for me to feel a good stretch in that quadricep muscle. All right, so this stretch, you don't necessarily need to do this 3 to 4 times a day right now, but at least twice a day just for these first 2 weeks. And remember I said gentle, so you want to feel a good stretch through here, but certainly no pain, and it needs to be a stretch that you can tolerate. So if you're gritting your teeth, you're really squinting those eyes, and you're just having a hard time, it's too far, you're just doing too much. I'll let you do that more in with the second exercise program, but just don't do too much for this stretch right now. We don't want to irritate anything. All right, so you have all the exercises you need for this first exercise program for the patellofemoral syndrome. Don't forget, if you commit to this for 2 weeks, even up to 3 weeks, and you've done it like I've said, but you have little to no change in your pain, or you would say that your pain is even worse, do not wait. Just go and see your doctor. There is something else that knee needs. Remember, I said that most of you will be able to find some relief with this exercise program, but some of you watching this video will not, and that's because of the particular cause of your patellofemoral syndrome. There's lots of causes, and because we're not in the same room, I can't do an evaluation on you to really get to the root of that and determine that cause. This is just something to help you figure out, if your patellofemoral syndrome will respond to this, that's great. If not, you need to get to the doctor. Don't forget about that ice and Advil. That can be really, really helpful. It's a good addition. Make sure that you're avoiding the painful activities as much as you can. And when your pain starts to go away, starts to decrease, and you're feeling better, you can start adding some of those things back in, just gradually. Most of my athletes and even the people I see that have to work and find that they're bending and stooping and kneeling, most of those people can go back to those activities. It just takes some good strengthening and some time, so you just have to make sure you give it enough time. And really, pain should be your guide throughout this whole process. So get started. I can't wait to see if this will work for you, and best of luck.